In my research work, I mainly design and conduct clinical trials, which means testing new compounds and treatment agents which hopefully are effective and suitable for early intervention and early treatment in young people. When I first heard about Orygen, maybe in the 1990s, I noticed that they really made a huge effort to reduce the duration of psychosis in young people and also to optimize treatment for people with the first episode of psychosis. And out of this work, a second concept arose, defining criteria for who is at a very high risk of developing a full threshold of psychosis. And this is basically the foundation of preventive treatment, aiming to treat people with subthreshold attenuated forms of psychosis to actually prevent the onset of a full threshold condition. Preventive treatment basically is a result of observations in large epidemiological studies. Those studies found that mild symptoms actually don't go away, but quite often lead to more severe symptoms. And therefore, it's important to think about preventive treatment. And psychosis and schizophrenia is certainly a severe form of mental health problems. And it is a chronic condition which is disabling. Therefore, it's important to intervene early and even more to try to prevent schizophrenia. The first studies of indicated prevention, which means there are mild symptoms, signs of a disorder you're trying to prevent, used low doses of antipsychotic medication or cognitive behavioral therapy. And those studies were successful, but unfortunately they didn't show sustained benefits, in particular those that used low doses of antipsychotics. So people kind of relapsed and developed more severe symptoms after they stopped the medication. And also antipsychotics are not feasible for early intervention because they do have a lot of side effects, like weight gain, for instance, which is not acceptable for many young people. There's a number of natural compounds which are very promising. Like one very interesting compound is cannabidiol. Cannabidiol is one of the main compounds in cannabis, and it's not psychoactive, so people don't get high. And there's evidence from small case studies and small clinical trials showing it really seems to work very well for treating anxiety. Another important area of our work at Orygen is in the context of those clinical trials to find biological characteristics, biomarkers, which indicate who may specifically respond to a treatment, but also who is probably at an even higher risk. So this is an important area which is emerging to personalize interventions, to target them specifically to people who are more likely to benefit from them. The treatments that are available for young people, in particular medications, they're actually not great. They're less effective in young people and they cause more side effects. And some of those side effects are serious, like inducing suicidal thoughts. This just highlights we need more research in this area. We need compounds which are benign, which don't have side effects, and which are not stigmatizing. And fortunately, there are some natural products with those properties, but we need clinical trials to show they are effective and helpful.